Perfect. There we go. Well, thank you so much, Adrian, for meeting with me today to do this segment on coffee with community connections during COVID. My name is Jordan, and I'm a social worker at the Thorp Recovery Center. I provide support to those we serve by facilitating opportunities and resources that will aid them on their recovery journey. The Thorp Recovery Center is an accredited nonprofit treatment center for those with substance use disorders. And yeah, like I mentioned before, today we have Adrian with us. Adrian is a house manager at Harmony House Sober Living in Edmonton. So thank you for meeting with me today.
Thank you for having me.
Yeah, we'll just jump right into it.
Okay.
Okay. So what is Harmony House's relationship with the Thorp Recovery Center?
Well, as you mentioned, we are a sober living program, and we like to help clients that are finishing treatment transition with a safe, sober place with other like-minded individuals where they can work on their recovery in early recovery after treatment until they transition back into their own house.
Perfect. Yeah, because we've had, when I first started working here as the first social worker at Thorp, I had connected quite a few of our clients to you guys over at Harmony House, which has kind of created a bit of a relationship between the two, because now we've established that connection, which is great, and can kind of connect back and forth when need be. Okay. And how long has Harmony House been in service, and are you guys a nonprofit organization?
So Harmony House has been in service approximately 10 years now.
Wow.
Okay. We are not a nonprofit. It is a for-profit organization.
Gotcha. So 10 years ago, when Harmony House was first, I guess, like created or established, were you guys, or do you know, like, if it was like the house that you guys use now was the original house back like 10 years ago that you've been using for sober living for individuals?
No, we don't have that house anymore. The original house we don't have. It basically started with a group of individuals in early recovery in their first 2 years of recovery. We were doing renovations for other homeowners and other housing people, and the owner of that company had to go out of town for a year and asked us to make sure that his house is maintained full. Right. And we decided to ask him if he would switch from regular rental to allowing us to house people in early recovery to help them move forward and transition with their life.
Wow, that's amazing. I had no idea. That's super cool. So is that kind of right when you came on the scene then? Like, is when you kind of started working, like creating Harmony House a little bit?
So Mark Melnichuk is the owner, and he started out in that position with a gentleman named Steve Sistakis. He's actually our medication delivery guy now.
Okay.
So the two of them, they actually started. In the beginning, I was working on just renovations and,
gotcha. Okay.
and things like that.
Wow, well, that's awesome. That's super cool to hear. Yeah, I had no idea about that at all. So that's super awesome. How has your guys' programming changed due to COVID, or has it not really changed? What have you guys noticed there?
Well, some changes. So obviously clients have to sanitize when they come in and out of their houses now. That's pretty regular.
Yeah.
All clients have to wear masks everywhere they go, pretty regular stuff.
Yeah.
So we do counseling with Addiction Services Edmonton. It used to be called ADAC.
Oh, yeah.
So lots of that is done via Zoom now.
Oh, gotcha.
For a while there, AA, NA, CA, all 12-step fellowships had been closed down to the public, and everything was done via Zoom. So there was a couple of small changes like that.
Right.
Another change is that we pre-COVID-19, we did have guests allowed in the house, and now we no longer have guests allowed in the house.
Right.
Staff needs to wear masks when in the house. So a couple of changes, nothing overboard though.
Right. Like more so just kind of, yeah, like you said, limiting having visitors come and also things kind of moving towards more like a technological side, like having to utilize Zoom and like those type of platforms.
Absolutely.
Yeah. Are your guys' clients allowed to go out and visit other people or go out to public spaces?
They are, but we want them to definitely follow all AHS guidelines. Well,
Right, wearing
so
the
they
mask, social distancing, all that.
absolutely, absolutely.
Excuse me.
Thanks.
Thank you. Uh, so along with like sober living, what other services do you guys offer and are there fees for these services?
Well, we can connect clients with others with other services. There is no fees for the other services, though.
Gotcha.
One of the things, we have a doctor that the company uses, and he welcomes new clients and patients of ours.
Yeah.
There's no fee for that. We have a pharmacy that we use, and we have a delivery system company that delivers medication on a daily basis to the clients in their rooms.
Okay, yeah.
He delivers them one day in advance. That's a service. Other services that we help connect clients with is follow-up treatment if they want to transition to another treatment center.
Gotcha.
And getting them lined up with their addiction services Edmonton counselor.
Awesome. Yeah, that sounds great. What was the one thing I was going to mention? Oh, now it's slipping my mind. It'll come back to me or it won't. We'll see. How can somebody access your programming, Adrian?
So there's a couple of ways. We do get a lot of word of mouth access to us. We have applications in numerous treatment centers and detox facilities, sometimes even remand centers.
Gotcha.
Most of it's done by client referral, done by counselors or social workers, and or treatment centers or detox centers.
Gotcha. Yeah. So can people self-refer to Harmony House, or does it need to be a referral process there?
No, absolutely. We do take self-referrals. I get a fair bit of self-referrals.
Gotcha.
So some clients that are in recovery or in early recovery are already attending meetings, and they talk to other people in meetings. They find out where they're staying, so on and so forth, things like that, and they let them know about us. And then we get more referrals. I definitely get a lot of referrals like that.
Yeah. I'm just wondering about that because I know that there are some agencies where they require people to be referred, like they can't self-refer, which I find kind of interesting sometimes. So I always like to just clarify if that's part of your guys' accessibility at least.
Yeah, no, anyone who has an addiction problem and would like to work on it and needs some structure and a safe place to do that, we can help them.
Awesome. Good to know. And do you guys have a website as well?
I am unsure.
I want to say back when I first started working here at Thorp, I think I may have found one. I think because there's Harmony House and then Her House, right?
Yeah. Okay,
Yeah.
So okay, so I know that we did some advertisement through the Good Shepherd's Guide.
Right.
We're all Christians, the staff members. We attend the same church. And we did put some advertisements up in there, and they put kind of a website up for us.
Yeah.
But I'm not sure of everything that's on the website. I know that the owner did put a couple of things up on Facebook for both of the companies.
Yeah.
I'm not on Facebook at all.
Yeah, fair enough.
I find that addictive and I stay away from it.
Yeah, fair enough. Yeah, I can totally get that.
But I do know there is information online somewhere.
Yeah, so if people wanted to like contact you directly, do they typically call you or email, or how does that kind of work?
Yeah, I get phone calls and I get emails.
Okay, gotcha.
Exactly how contact's done.
What are the requirements to enter your program?
Well, a client definitely has to be able to pass a urinalysis test for all substances.
Right.
So it must be completely clean and sober, and for at least a great enough period of time to pass all drug tests.
Right.
Okay. The willingness to work on the recovery, that's necessary. That's one of the first things that gets assessed on an interview.
Gotcha.
We have to fill out an application, and then we do an interview, and generally we need to have funding lined up for the clients.
Prior to.
Yeah.
Gotcha. Is there like a requirement on how many meetings clients have to attend per week or anything like that?
Oh yeah, those are requirements after they become a client. There's definitely many requirements after they've become clients that they have to follow up on. So generally we want clients to be going to a minimum of 5 meetings per week.
Gotcha. Yep.
Okay. Plus we have AA in the house every Thursday. And
Okay, nice.
And we have another meeting on Sunday, which is staff and clients going over, and it's more of a discussion meeting.
Okay, just kind of check in and see how everybody's doing type thing.
Yeah, absolutely. It's everyone together, and with staff, we check on attendances, things like that.
Awesome.
Other requirements that clients need to do when they're with us, we do have a curfew.
Okay.
So everyone needs to be in by 11 o'clock at night. Okay. After 30 days, it changes to 1 a.m. on weekends and holidays, but it's still 11 during the week.
Right.
After 30 days, passes can be granted. Out of town work can start, things like that. But they need to be approved 3 days in advance for accountability reasons.
Right. Yeah, that totally makes sense too. And to kind of get them into like a more structured routine before they just leave for the evening every evening type thing, right?
Absolutely.
Okay, yeah, that makes sense for sure. Yeah.
Okay. All clients do need to attend counseling and have an active addiction services Edmonton counselor. They can also choose to get counseling other places, but we can refer them in there and line those up for them.
Right. So once they kind of get to Harmony House, then you guys support them with getting connected with those different types of services and whatever they may need type thing. Yeah.
Absolutely.
Okay,
Absolutely.
cool. That's awesome. Yeah. Kind of be doing that referral process for them too, right?
Yeah.
Yeah.
So in every house, we have 12-step working guides from Narcotics Anonymous, because we help everyone with every kind of addiction, alcoholism that you can think of. And that particular book covers a wide variety and range of all of addictions. So, so we have everyone working through those books. They have to work through them. We have a minimum amount that needs to be met weekly. We do check on progress. Okay. The way to work the 12 steps from the 12-step program is with a sponsor. So when a client gets there, if they don't have a sponsor, we give them a couple of weeks while attending meetings to research who they would like to be their sponsor. If they don't connect with someone, or sometimes they're a little shy or timid, then we have some senior clients that have more than a year clean and have completed the book and have sponsors of their own and have now finished working on the steps, and instead of continuing to work on them, they work on the steps with other people. So they're still practicing them, but more pushing on the area of the 10, 11, 12 and the steps.
Right. Yeah. And that makes sense too. Yeah. Because, and with that too, like they're still making those connections as well, right? So it's not just them on their own working through these steps. They have people who are like-minded wanting to do this as well.
Oh yeah, absolutely. That our senior clients helping the newer clients it's very helpful to both of them. It keeps
for sure, yeah.
Each other, and it increases accountability. And sometimes a client is more likely to speak to someone who's already been through our housing program and gone through the exact same things as them.
Right, exactly. So they can kind of be that confidant for that person, right? And kind of help pick them up when they're down, if they're having really low days and that sort of thing.
Absolutely.
Yeah, I love that. So along with the programming, have you guys noticed like if there's any preconceived barriers for your programming that potential clients do not need to be concerned about?
Well, right now, just due to COVID-19, they can't have any guests
Right.
in the house.
Yeah.
So sometimes that can cause a barrier because some clients are trying to work on maybe getting their children back in their lives
Right.
or family back in their lives, and they can't just have them come in just due to the AHS regulations right now.
Exactly. Yeah. And that's like something similar here with Thorp as well. Like a lot of our policies and procedures have changed due to Alberta Health Services, and it's not really a choice that we get to make, right? Because obviously we want our clients to be able to see their loved ones and connect on a regular basis. But unfortunately, it's kind of taken out of our hands at this point. Do you have wellness and recovery plans? And if so, what are they?
Well, our initial goal is for our clients is them to move in, work on their recovery,
Right.
slowly transition into education to further advance their career options,
Right.
or get tickets or training, and or get back to work, and then
Right.
transition into their own place and become productive members of society again.
Right. Yeah. So it's basically just making sure that they're being productive with their time and that they're not just like hanging out at the house by themselves, like watching TV all day type thing.
That's right. No, we want all of our clients to be social. Actually, we don't even allow TVs in the bedrooms because,
Oh, really?
well, previously we did, and then
Okay.
clients would hibernate in their rooms.
Yeah, I get
Right?
that. I get that. I can tend to do that at my own house too. So
That can happen to anyone, actually.
exactly. But it's a really good point, right? Because by taking those TVs out of their bedrooms, that makes them more like inclined to want to go and connect with other people, right? Because they don't want to just sit in their room by themselves all the time.
Yes.
Yeah.
People can still be very attached to their cell phones, though.
Oh my goodness. Yes, for sure. Like it, and like you said, like with Facebook and like all these different social medias now too, they can become so time consuming.
Oh, absolutely.
Yeah,
Absolutely.
for sure. Is there like a way that you guys monitor that at all, or can you monitor like cell phone use?
Uh, that one's very tough. Clients, I gotta say, clients use their phones a fair bit.
Yeah,
And that's tough to monitor. It's tough to tell them if they're being on them too much.
exactly. Yeah, it's their own property, right? So,
Yeah, like sometimes I see clients that are on their laptops, their headphones on, at all times and doing things. But if we notice that it's a continuing, ongoing thing, we let them know that we need to start transitioning into doing other productive things with our time.
right,
So
for sure.
one of our rules is that once we hit the 3-month mark, uh, we do need to be doing more productive things,
Right.
right?
Yeah, because at that point they've kind of settled in and have gotten a bit more comfortable with their environment that they're now in.
Yeah, absolutely. Because we're transitional. So first 3 months is work on recovery, stay safe, stay out of trouble, don't go places we haven't that we used to go to, things like that.
Yeah.
After that, we want them to start transitioning into doing more things, getting out and about more,
Right.
work, school, so on and so forth. And then by the end of they can stay for up to a year. So by then, a client should have, done things like gotten new IDs if they don't have ID,
Right.
healthcare cards, social insurance cards, things like that. Started to pay off fines, if not, paid off fines, transition into work or school, and continue to become more productive.
Right.
At the 1 year point, provided a client is doing all those things and everything's going well, they are welcome to put in for an extension. I do have a few clients that have been with me for a number of years.
Wow, that's amazing.
They started by graduating a treatment center, coming in with us,
Right.
and just moving through recovery, and then they did some upgrading to get through grades 11 and 12, and then now they're doing university, and well, now they're doing university online. They're
Right.
they're not going to school, but they're doing it online, so it does look like they're on their computers a lot, but they are doing their schooling.
Exactly. Yeah, and I guess that's where that give and take is too, right? Because especially with everything pretty much having to resort to being online or through Zoom or what have you, like, yeah, it would definitely increase that phone or screen time.
Yeah,
Yeah,
absolutely.
no, for sure. No, that's awesome. Do you have, before we wrap up this interview, Adrian, do you have anything else that you would like to mention or talk about?
No, I could just mention that for our men's side of the company, we do have 9 houses. We do have 65 bed spaces. Generally, there is always a few spaces, and it's not too hard to get a client in. And provided a client is willing to work on the recovery, they can always change their lives.
Right.
Our past is always our past, and we can't change that. All we can do is start fresh and create a new future and a new ending.
Yeah.
And that future and ending can be beautiful, provided that we always take the next right step.
Mm-hmm. Yeah, no, I honestly couldn't have said it better myself. I think you kind of took the words right out of my mouth there. So yeah, I really appreciate you taking the time today, Adrian, to sit down and chat with me a little bit. And it's been nice to get to put a face to the name now, since we've kind of worked together a bit for a while. So yeah, I just really appreciate your time today. And thank you so much for joining us on this segment's Coffee with Community Connections during COVID.
Okay, thank you.
Thank you. Take care.
All right, have a nice day.
Thanks, you too.
Bye-bye.